many of you know, we opened the center 3 years ago, November of 2010. It was named in honor of Matthew J. Morahan III. It's grown unbelievably over the past 3 years, and you're going to hear a lot about that this afternoon. The center basically provides 3 or 4 key programs, one being an assessment and rehabilitation program for sports-related injuries, the cardiac and concussion program that we're going to speak a lot about this afternoon, education programs, and really a state-of-the-art sports training program for athletic trainers. The announcement this afternoon is basically our statewide expansion of that program, that athletes now throughout the state of New Jersey will have a wonderful opportunity to access the program, to be evaluated, and to hopefully put some preventive measures in place.
This is no longer a program with one site. We have decided that this program is so spectacular, which it is, that it needs to be spread throughout the state with the state's largest healthcare system as its sponsor. And so we are opening venues of this service at each of our general acute care hospitals, and there's 6 of them. And of course we have the mobile van that you have seen outside, which will travel throughout the state and offer services to clubs, athletic departments, school systems, so that truly no child needs to go unscreened or unevaluated as they participate in sports. On the clinical side, we have taken the protocols that have been developed in this center and incorporated them in our emergency departments in order to make sure those presenting under those circumstances will have the benefit of the program that's been developed. I think from a Barnabas Health standpoint, this is precisely the kind of mission that we believe we need to be committed to. We treat people when they're sick for sure, but we think we need to contribute to the lifestyle of everyone before sickness becomes apparent.
We want to focus on the short period of time that we've grown the program to include our numbers. Today we are proud to say that we've reached over 7,000 screenings since program inception. That includes over 15% that were post-injury tests as a result of a concussion or head injury, and 18% that we had to follow up on as a result of an abnormal EKG, flagged blood pressure, or flagged medical history. As the program coordinator, I think those numbers speak for themselves in committing to our mission and our message and our overall commitment to wellness.
It's an honor and a privilege to be here speaking on behalf as a spokesperson with Joetta for the Matthew J. Morahan III Health Assessment Center for Athletes. I couldn't tell you how excited I am to be a part of this. When I was contacted and discussed and introduced to the Matthew J. Morahan Health Assessment Center, I mean, this was something that hit home for me instantly. Both my father and my grandfather passed away from heart attacks at the age of 59. So I know that the cardio screening, EKGs, all the things that I've taken care of throughout my 11 years and then will continue to take care of, it's important to me because I know it's helping save my life.
When I was younger, I never thought I would have this opportunity because I was diagnosed with a heart murmur at a very early age. I was told I had the heart murmur, did not know what to expect. My parents took me to the doctor. They said, you might outgrow it, you should be okay. Let's fast forward. The Matthew J. Morahan Health Assessment Center for Athletes, they have EKGs, they have doctors, they have things in place to diagnose you, get pre-data and also post-data. I didn't have that opportunity. Luckily and fortunately for myself, I didn't have any other problems. I outgrew that and I went on to make Olympic teams. This program is so very important because we need to have screenings, but more importantly, we need the community to know that you have to take advantage of what is out there for you.
There is a true significant moment that is happening here today. You're talking about a collaborative effort that really engages in a proactive approach. And that when we talk about people taking advantage of free programs, the stamp of approval is here. Barnabas Healthcare has a credibility amongst New Jerseyans that's undoubtedly never questioned. We know we're going to have access to the best when Barnabas lends its name.
Last year, in the school year, Red Bank Regional lost 2 students, 18 years old, 17 years old. Rihanna on September 10th, 2012, and Albert, December 3rd, 2012. I don't know if you know what it's like to be in high school today. All of you, I'm sure, attended high school, I hope. But high schools are a place of incredible life. They're a place of incredible energy, incredible passion. And when you lose a student, that life gets completely drained out of your environment. This past August, we screened, the folks came down and we screened, of our 300 fall athletes, we screened 247 students over 4 afternoons. And how they did that, I really don't know, but they did an amazing job. A lot of coffee, yes. And what it gave us was a tremendous amount of peace of mind for our families, our students. But we still have 2 students who've not been cleared to return to play. And we're following up, and those students are continuing to follow up. And what this program has, quite frankly, done is it's saving lives.
My daughter Hallie is 11 years old, and last year she sustained a concussion. It was a low-grade concussion, and I never really had dealt with it before, and neither had my ex-wife. And we brought her over to Barnabas Health, and they screened her, and we wound up seeing a pediatric neurologist, part of the healthcare system. Wound up, long and the short, my daughter was out for 5 weeks from soccer. An 11-year-old wants to go out and play, and they want to do these things, and having the right support staff around you is very key. And I just want to say thank you very much again to the Morahan family and to Barnabas Health.